There's a lot of research being done now for ketamine for people with traumatic brain injury, for stroke victims, because the issue is, how is it making neurons grow? It's because it's not making, we don't think all neurons grow. It's not like you do ketamine treatment and suddenly you can play piano better. Although I have had a few patients who have told me anecdotes like that. But mostly we think it's doing something with your critical social neuroplasticity. So it's the kind of, when we were teenagers, we were still very neuroplastic. And that ability for the brain to grow and change kind of goes away at the end of adolescence. It's not completely, like we can still change until our last dying breath, but it's harder to teach an old dog new tricks, right?
Thank you so much for joining us on another awesome episode of Bioenergetics Beat. I'm Heather Gray, a functional diagnostic nutrition practitioner and certified bioenergetic practitioner, and today is brought to you by Nikki, Unleash the Wellness Within. It's a non-invasive, easily affordable, and highly effective approach to optimize wellness. It's a wearable device that puts frequency-based better life in your hands and on your wrist. But make sure to stick to the very, very end, because you're not going to want to miss one word that my next guest is about to talk about. We're going to hit a fun topic that I love talking about, and that's ketamine therapy and mental health. And, there's so many issues right now, especially in the United States, with mental health issues. And what a time that this stuff is actually legal now, and that we can use this to, access things that would have been too traumatic in the past, that we can actually now work through stuff. But without further ado, let's welcome Dr. Jen to the show. Yay!
Hi there. Thanks for having me.
Absolutely. So where are you calling in from today?
Los Angeles. Well, actually, technically Santa Monica, which is in Los Angeles.
Ooh, fancy. I love it. I love it. I am in Puerto Vallarta, Mexico, and this company is actually based out of Canada. So we're all over the world today. So tell us a little bit about yourself. I want to know your background. First off, what made you want to become a doctor to begin with? And then, how did you become a doctor talking about ketamine?
Well, it's kind of a long story, but the short of it is I wanted to be a psychiatrist or a psychologist. And I looked into it when I was younger and I thought, oh my God, I'd have to get a 7-year PhD to be a psychologist. That sounds like a lot of work. And then I kind of thought maybe going to med school might be easier because it was only 4 years of med school. So I thought I would do that. But then when I got to med school, I was a little discouraged by what psychiatry had to offer in terms of medication and in terms of therapy. It just seemed a bit limited. So I switched to specializing in emergency medicine, and I still am an emergency medicine practitioner. For 15 years, I worked at a very busy emergency room. And then when COVID happened, it gave me an opportunity to sort of pause and reassess my priorities. And one of the things that we do in emergency medicine is we do anesthesia in emergencies. And so one of the medicines that I used a lot was ketamine for anesthesia. And I know, like a lot of doctors over the years, noticed that people would wake up from, say, getting their hip relocated or something, right? And they seemed remarkably transformed, that they had had sort of like a mental health breakthrough of some sort. And so I love doing it so much that I would actually volunteer for my colleagues to do it, because it's a little bit of extra work. If somebody has a dog biter and you're sewing it up, you have to use ketamine. It's a little extra work. So I would volunteer to do it for my colleagues because I loved seeing patients wake up from ketamine so much. I didn't know anything about the research. And all the research that was being done about this, it was being done sort of from the 2000s on. And so when COVID happened and I was looking around and I wanted to sort of reconnect with why I went into medicine in the first place, which is to help people. And I was fascinated by mental health. And, there's 20 years now of this amazing research, not just about psychedelic medicine, but specifically about ketamine, because ketamine is a legal medication that we've been using for 50 years. And when I looked at the research, I was just sort of blown away. I couldn't believe it, the kind of rates of remission that people were getting. So I went and opened a ketamine clinic. And so for the past almost coming up on 3 years now, myself and a business partner, we kind of started our own clinic, and we've been treating folks for mood disorders, chronic pain, depression, lots of things.
Oh my gosh. Well, you said it so fast. It almost sounded like you said illegal, but you said a legal drug. So
yes, sorry, completely legal.
I was like, no, it's legal. And you cracked my shit up. You were like, 7 years, that looks way too much work. Like I did that myself. It's so funny. It's like you look at it and you're like, ooh, like that's a long time to be in
Yeah,
a hardcore environment. And then to come out with such limited resources, like you said, therapists can prescribe or they can do talk therapy, and we're starting to find out that neither fix right the core issue. And a lot of times talk therapy, a lot of research is coming out that it'll kind of keep people stuck in that
right.
in that trauma, right? So like
Yes, yes.
not discouraging talk therapy. There's a time and a place, but I'm glad that there's a bigger toolbox that we're getting to play with these days. And again, you cracked my shit up with like, oh, I saw how these people were coming out of it, so I volunteered. Yeah, that's amazing. Thank you. This is a good spot, actually. We're just going to pause real quick for a break because when we come back, I really want to dive deeper into the nitty and gritty and really kind of break apart, what is ketamine therapy? Why does it work? Are we having so much success over other types of therapies out there? I myself have done low dose ketamine therapy in the past, so I also am fascinated with mental health, with a uncle committed suicide when I was 4 and my own health
Mm.
issues throughout my life. And just seeing what's happening in this country, the United States of sorely lacking tools to truly help people with addictions, mental health, chronic inflammation, that type of stuff. So, God bless you for stepping out on the fringe, right? And saying, oh, well, there's another way. So, stay tuned. We'll be right back.
There's a new word for wellness, Nikki. Nikki is your personal wellness companion, a sleek, wearable device that lets you choose from a variety of programs to match your day. With a simple tap on the Nikki screen, you can explore wellness programs created for different moments and lifestyles. Need a lift? Select energy. Looking to unwind? Tap stress and anxiety. Want to feel more at ease? Choose pain. Heading out on a trip? Try travel to help you feel ready for new adventures. From busy mornings to quiet evenings, Nikki puts a variety of wellness experiences right at your fingertips and on your wrist. Life moves fast. Nikki moves with you. It's a portable way to bring wellness technology into your everyday routine, wherever life takes you. Your day, your choice, your wellness program. Nikki Wellness Technology. Delivering frequency enhanced health. We are Nikki.com.
Oh my gosh, welcome back. Are you excited to jump into this as much as I am? I bet you are. So tell us a little bit, give us a little bit of history right now of ketamine and what is it and how does it work and all that fun stuff.
Absolutely. So there are a lot of misconceptions about it. And one of the good things about this medication is it's been around for over 50 years. And I say good things because that means we know about it. We know the ins and outs, we know the side effects, we know, some of the bad things that can happen if you take it. And that's not always the case when a new medication comes out. Sometimes it takes a year or two before we say, oops, it turns your toes purple, right? Um, so ketamine first came out around the 70s, and it has been used as it's the most widely used anesthetic on the planet. So if you can imagine, paramedics use it, plastic surgeons, dentists, ER doctors, anesthesiologists, surgeons. And the reason why it's so widely used is because we found out very quickly that it's a very safe medication. So like I first trained on using it 20 years ago to use in children because it was so safe. They would park me in the corner when I was doing my training and residency of the Hasbro Children's Hospital, and any kid that came in that needed a procedure done, like a broken arm or a laceration, I would use the ketamine to rapidly give them conscious sedation. So it's kind of like almost like anesthesia. Um, and because it's so safe, we can use it in a large population of people with a large number of medical problems. And that's a good thing. But what they started to notice at the end of the 1990s in veterans first is that people would wake up from a procedure and they seemed better, like their mental health seemed better. And that's, I mean, you don't get very many things in medicine where you will give a treatment and then people seem rapidly much better. I mean, there's like antibiotics and fixing a broken leg, and that's like everything else is a lot more difficult to come by, right? So when people started noticing that, they constructed some really good studies. And actually, there is an enormous amount of very good evidence for this working. But what it works for seems to be things that have to do with more with mental health, mood disorders. Although I should say it also works for chronic pain, and we think maybe for some of these chronic inflammatory conditions. But there's still so much research going on. So for the past 20 years or so, what we've discovered is that for people, I'll just take depression, for example, for people with what we call treatment-resistant depression, which is defined differently by different insurance companies, but it essentially means you've had it, you've tried maybe an SSRI or two, and it hasn't worked, right? For people with treatment-resistant depression, anywhere from 60 to 80% of them who go through a course of ketamine treatment will have what we call long-term remission from their symptoms, which is as close as we're going to come to saying a cure, because there's no cure for depression, right? And those are amazing numbers. Like 60 to 80% is way better than SSRIs. It's way better than therapy. And how it works is a little bit of a whole different paradigm. It kind of is not the, you're maybe used to hearing, oh, depression's a chemical imbalance, which is really oversimplified and not exactly what we think is going on anymore. And the way it works is it promotes something called neuroplasticity. So we all know what that is because we've all been kids before. And we know that kids are really neuroplastic. They can grow and change very quickly, right? And after each ketamine treatment, what we're doing is we're boosting the brain's ability to grow and change fast so that it can heal itself.
Okay. Wow. So God, there were so many questions that came up during that, but then you'd say something else that was just amazing that kind of took me off. I probably should have been taking notes, but I was just so fascinated listening to you. So but to get a little bit more into the nitty gritty on how it works and how is it that it can be so successful against depression and then also work on these inflammatory and pain things as well?
So the neuroplasticity part is the part that everyone sort of knows the most about. And actually, I just want to clarify, a lot of people think that this falls into the category of psychedelic medicine or something that's illegal or something that's out there, like really not approved. I just want to say I'm an MD. And that this isn't something that is sort of that out there. The protocol we use is called the Yale Protocol, which, a lot of this research was done at very esteemed institutions all over the world. So, and what we're seeing from combining animal studies and human studies, what we're seeing is that for people with depression, we think that there's a part of their brain where their neurons are maybe too short. That's what we see from animal studies, right? So when after ketamine therapy, their neurons grow back, those neurons grow back and they're longer and they match the happy animals or the non-depressed animals in terms of controls, right? We can't see that in humans because we obviously wouldn't be ethical to cut open people's brains while they're getting research on, right? But we do see in humans that there is release of something called BDNF, brain-derived neurotrophic factor, which tells your brain grow, change. There's also this body of research now that shows that ketamine also works on something called the astrocytes. The astrocytes are kind of like the maintenance crew, the cleanup crew for your neurons, for the brain. So they interface with your immune system and they take care of your brain. Now, we all know the brain is sort of protected in a very special way from the rest of your body by the blood-brain barrier. So the way your body's immune system treats your brain and regulates your brain is very different from the rest of your body. And so the astrocytes, they're the sort of special SEAL Team 6, they're responsible for the brain. And we see now there's a lot of research being done on ketamine regulation of the astrocytes. And we see that and it's very preliminary, so I hate to quote it, but there's some indication that it might reduce inflammation in the brain, which is associated, as you know, with things like depression, anxiety. Yeah.
The astrocytes, is that the same thing as microglia?
They're astroglia, we call them.
Oh, okay. Thank you. Because I was like, wait, immune system in the brain. I thought that was okay. So thank you for that clarification. Yes.
Yeah, astrocytes are special because they get to take care of the brain. But that is all, there's a lot of research being done now for ketamine for people with traumatic brain injury, for stroke victims, because the issue is, how is it making neurons grow? It's because it's not making, we don't think all neurons grow. It's not like you do ketamine treatment and suddenly you can play the piano better. Although I have had a few patients who have told me anecdotes like that. But mostly we think it's doing something with your critical social neuroplasticity. So that's the kind of, when we were teenagers, we were still very neuroplastic. And that ability for the brain to grow and change kind of goes away at the end of adolescence. It's not completely, like we can still change until our last dying breath, but it's harder to teach an old dog new tricks, right?
Wait. So if I were to take that now, being in Mexico, it would help me learn Spanish better?
No, exactly.
Oh?
That's what I'm saying. It's not, I've had a few patients who've given me some weird anecdotal things, mostly sports related, but no, the idea is that you're getting that neuroplasticity in a part of your brain that has to deal with your identity, your feelings, how you interact with other people, your mood, how you manage your emotions. That's what we think, but it's still, a lot of it is a black box.
Fascinating. So when people are doing, and I know this is different for everybody, but there's got to be some sort of a somewhat of a range, how, because like I said, I did low dose ketamine therapy for maybe like a month. And I really didn't notice a whole lot from it. But part of me now, after having this conversation, is wondering if I didn't not try it for long enough. When do you typically start seeing, people start getting improvements?
So I should make a distinction. There's lots of different ways to get
Ah,
ketamine therapy. So low dose oral, you were taking as a
yep.
lozenge, or yeah, okay, that's different a little bit than intranasal ketamine, which is like Spravato, which is a insurance covers Spravato, which is intranasal. You can spray it in your nose. And also what we do Spravato, but we also do intravenous ketamine, which is the most sort of, you can get the most amount of medicine across the blood-brain barrier with intravenous. So it may be for someone like you that you needed to do the IV formulation to see an effect. But generally speaking, when we do the IV formulation, we do it over 2 or 3 weeks. We do multiple infusions.
Okay.
So usually it's 6 to start, 8 or sometimes 10 infusions over 2 to 4 weeks. And then many people, when you look at the studies, when you're talking about IV, you see that 51% of people will start to see a benefit after 3 treatments, which is slightly greater than tossing a coin. And after 4 treatments, that number goes up. After 6 treatments, it's closer to the 60 to 80% range, depending on the study. And then as you get into higher numbers, it sort of tapers off. So you generally do need multiple treatments before you start to see that. And that makes sense, because what we're doing is opening a window of neuroplasticity and holding it open so your
Mm,
brain can change and grow. The other part of it, and this is the part that science doesn't address as well, is the psychomimetic effects, or the psychedelic medicine part of this, because ketamine incidentally also produces a little bit of you might call a trip or a trance-like state, and in that setting, people can have these amazing breakthroughs. And what we know about the science of that is, when people are under the influence of a psychedelic medication, whether that's ketamine or if it's like psilocybin from mushrooms, if you put them in a functional MRI machine, that's an MRI machine that looks at what parts of your brain are lighting up, right? What we see is that the medicine seems to turn off a part of your brain called the default mode network. And that's the part of your brain that's sort of telling you what reality is and what's important. And so, like, for example, right now, your carotid artery is right here and it's really loud. It's beating, boom, 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 boom. And it's right next to your ear, which is quite sensitive, but you don't hear that, right? You don't hear it right now, right? But
yeah,
if you were really scared, maybe, or really anxious or falling in love, you might suddenly feel that or hear that, right? So there are a lot of things that are going on right now that are very real, but that your brain isn't considering for you, that boss, right? And so what happens when we shut down the default mode network? It can't really regulate what parts of your brain are allowed to communicate with each other anymore. And so all these different parts of your brain are suddenly communicating with each other in ways that the boss doesn't usually allow. And that produces, for some people, these amazing insights. Sometimes people have recovered memories. Sometimes people talk to God or dead loved ones. But sometimes they see nonsense like pink elephants, or they'll wake up and be like, God, Doc, what was that all about? I saw, like, some spinning cartoon figures. What is that? And it's like, well, that may have just been what you saw on TV last night, right? So that's the part where it's tricky, and science can't really answer that. And that's the part where you hear people get very, for lack of a better word, evangelical about the treatment, because if they do have a breakthrough during one of the sessions, then they'll come out, and I've heard this a million times. People say that was like 20 years of therapy in one session, or oh my gosh, my whole life, my therapist and I have been working on my self-esteem issue, but now I get it and I feel it, and it's different. It's different when you feel it than when you know something sort of intellectually, right? And so that's the part that's hard for science to sort of get a handle on.
totally makes sense. And that's why I had said that at the beginning of, kind of dampening down something where our trauma just are not letting us go into, it kind of opens up that gate and allows us to actually, sit with these things and learn a different way instead of shutting down. Oh, trauma, shut down. It's like trauma. No, you're alive. It's okay. Let's see what this is like. So like I said, I'm a huge fan of, and I felt that way after ayahuasca. I did ayahuasca once and I was like 25 years of therapy in one evening. And it was absolutely
Yes.
mind blowing, heart blowing, all blowing. And, it really helped open up that door for the rest of my healing, because I had been focused, a lot of us in functional medicine and Western med, especially, we're so focused on the physical, the physical, the physical, the physical, and we leave the mental emotional out, right? We leave the
As,
feelings out.
as if they were separate things, which they're not, right?
Which is total ludicrous, but it
Right,
wasn't
right.
until 2020. You had talked about COVID earlier too, and I was like, that was a blessing in disguise for a lot of things. Because they said it allowed you to have a pause and churn and do things differently. It was at the time that allowed me to pause and look at things differently, because I had been relapsing again for like the 6th time with my health, as a functional medicine practitioner. And I was just like, okay, I'm doing all the things that I'm preaching, and this is still happening. That means there's a piece that I'm missing. What am I missing? Right. And then that's
Right.
when all this mental, emotional, nervous system regulation, trauma work, somatic breath work, plant medicine, came into the play. And that's what's completely changed my life.
Right. And your experience on ayahuasca is very similar to what many people experience with ketamine, especially with IV therapy.
No,
So,
I know. And now that
and
you're
that's,
talking about it, I'm like, I want to get on a plane and come see you.
well, you should, you should.
Oh my gosh, that'd be amazing. Tell us a little bit about, so how old can you work with folks? And, you said so let's start off. You said relatively safe for a very large population. What are some of the side effects or some of the issues that you can run into?
Absolutely. So it's relatively safe in the right hands with the right person monitoring you, right? I should caveat that. IV ketamine therapy should always be under you should be monitored by either a nurse practitioner or a physician. You For oral therapy, it's less important because you're not going as deep. So it is, I mean, at higher doses, it's anesthesia. So you do have to be careful. If you're using it incorrectly, you can become over sedated and all the risks that go along with that, including stopping breathing, right? But we don't, obviously, when you're receiving it from the appropriate practitioner, that doesn't happen. But that is a theoretical concern. The other more common side effects are nausea, a dizziness. The good thing about ketamine is very rapid on, rapid off, which is one of the reasons it's so safe. So if somebody has a bad reaction, you just turn it off, and 5-10 minutes later, it's like they're sort of coming back. So there are some people who should not do ketamine therapy. People who have psychosis, right? So schizophrenics, anyone who's got depression with severe psychosis, that they shouldn't do that. It can make that worse. Same thing with mania. If you're in the middle of a manic episode, it can make mania worse. People with uncontrolled, poorly controlled heart conditions or hypertension that's badly controlled, you want to talk to a doctor about that, because ketamine can increase your heart rate and your blood pressure a little bit. But otherwise, it is fairly safe. When I use it in the hospital, I've used it on toddlers all the way up to people in their 90s. So that's a very wide range. And people who are, generally we use this medicine. There is a reason why, as an ER doctor, we reached for this a lot first. It's because it's very safe, even people who are very sick or who have just been through like massive trauma. So there are a few considerations there, but that's why you should, talk to a doctor before you get IV therapy, certainly.
At the beginning of this talk, you said use for mood disorders. And when I think mood disorder, I think narcissist. Can we fix narcissism?
No. So narcissistic personality disorder. So it's really important, actually. That's a really good point you bring up. It doesn't change your personality at all.
Okay.
So people think, and this is where you get into like what really is depression, and to this idea that it's somehow associated with like willpower or something, which I really resist. And I'll give you an example. I've had a few patients who I don't want to say cured, but they feel like they're cured. They say, oh my God, I can't believe I'm cured. Or they'll say, I can't believe that I was living like this for 20 years. Like I didn't know how bad this was until I started to feel better. Then I realized, oh my God, life can be so different. And when they do that, then they say, oh, all this time, I thought I was lazy. I thought I would, because I couldn't get motivation to get up in the morning, right? I thought I was a bad mother. I thought I was, and it was the depression all along, right? And so it doesn't change your personality. And so if you have a personality issue, it's not going to change that. A narcissistic personality disorder is a personality disorder, right? But it does help you change and grow faster. So if you're working on something with your therapist or your pastor or whatever, if you're working on some aspect of your personality, it can help you work through that faster, but it's not going to change who you are fundamentally. And that's good. We wouldn't want to do that, right? You don't.
Gosh. Well, I didn't
And
realize there was a difference between mood disorder and personality disorder. So thank you for clarifying.
yeah, mood disorders are depression, anxiety, and and you mentioned earlier trauma, which isn't necessarily a mood disorder. Like PTSD is not necessarily a mood disorder. PTSD is really interesting, and psychedelic medicine, but ketamine specifically, can really help with that because it can, as you pointed out, allow you to experience again the trauma but not be a participant. And there is a funny thing that happens with human beings. When we watch something happening on TV or we read a book and something happens, we have empathy for the person, most of us. We have some empathy for what's happening. And that makes us react to the trauma in a different way than when it happens to us. We can't have the empathy for us because we have to go into flight or fight mode when we recall the trauma, right? And we live it. Your body has to do that because it's trying to protect you. So it doesn't allow you to sort of address things in a way that will help you heal sometimes, because it's so busy trying to protect you from it happening again that it activates all these defensive mechanisms that doesn't allow you to heal. And this will separate. Ketamine is also dissociative. So what it does when you go into a session is you sort of almost, you kind of feel, a lot of people feel like they disconnect from their body a little bit, and they experience things. Sometimes they take rape or something, for example. You might see it again, but you feel about it the way you would if you were reading it happening to someone else or seeing it on TV. You suddenly see and have empathy for yourself in a different way. And people will come out of that transformed, right? And you mentioned that experience with ayahuasca because you can see your own trauma in a way that's different and allows you to heal.
That's absolutely beautiful. Again, I had like 2 or 3 really great questions come up, and I just get so enthralled with what you're saying that I let it go. But thank you for that explanation. That was the most eloquently put, and just really distilled down to where I think just even the regular like layperson can understand. So kudos to you for having that it is a talent, right? Of not talking over people's heads and actually being able to communicate at a level that most people can understand. So blessings. Appreciate that. We're kind of getting to the end here. Are there any little last nuggets that you want somebody to know about ketamine therapy? Who it's working for, realistic expectations, that sort of stuff.
Well, I always tell everyone, look, if you take the best studies and you say 80% of people with treatment-resistant depression get better, that still means if you take 10 people and bring it to me, 2 out of the 10 of them it might not work for, right? So if it doesn't work for you, that doesn't mean that something else won't. Maybe ayahuasca will, maybe a good therapist will, right? So don't feel discouraged if it doesn't work for you. I think the main thing I want to leave people, most of the people that I speak with they're scared of it. They're scared of it for a number of reasons.
One that was what's the term? Can you explain? I've heard a K-hole. What is that?
Oh, okay. A K-hole is sort of a slang, like street vernacular for when you get too much ketamine too quickly and you feel the sensation is as if you've been sort of dropped into a place where you can't move and you can't escape, like almost like a hole. And it can be scary.
Oh, that doesn't.
But that shouldn't happen. If you're getting it appropriately by the right person, you shouldn't get it. You shouldn't have that experience. But if you do, it is very transient.
Okay, well, that's
people are scared. Yeah, people are scared because they think it's a drug or they've read some bad news, like what happened to Matthew Perry, which was terrible. And with any medication, I just want to say, like, having been a doctor now for 20 years, with any medication, you can use it the wrong way, right? Any medicine can be abused. So not to discount that there are people who suffer from ketamine addiction, there definitely are, but this is a very powerful medication that can help people. So if you go to a doctor or a nurse practitioner and you use this in a way that is the correct way, you can minimize the risk of that and you can still get something that can be life-changing.
Oh, it totally makes sense. And I'm all for life changing. There's been, and just in this world right now with what's going on, there's so much trauma and uncertainty and not feeling safe. And, I think if we can get more empathy, more kindness, more healing on this level, I think that's when we're going to be able to heal, the population in general. And so thinking outside the box, not giving up, because like you said, if this hasn't worked for you, I've tried so many different things, and the Nikki, they've got an emotion and a stress and anxiety frequency that I use quite
Mhm.
often to kind of help regulate my emotions. So, but yeah, if there's something that hasn't worked for you, don't give up, keep trying. There's especially these days, we are having so many tools and we've got so much bigger knowledge on how the brain actually works. And I'm so glad that a lot of this previous stuff is being debunked, and we're really getting into the meat and
Right.
potatoes.
And well, and you bring up a great point too, because one of the things that I've learned from this journey is that we can still change, right? We are still neuroplastic. We have that capacity. The brain can still heal itself. So even if you've been suffering from something for 20 years, it doesn't mean that it's going to be forever. There is no forever with biology, right? So um, I just, that's something else that I feel like it really is important to remember, that there is still the capacity to heal and change, that as long as you're alive, the brain can do that.
Oh my gosh, can I get an amen? So this is the shameless plug time of the show. So where can people find out more about you and the type of work that you do?
Well, I'm based in Los Angeles, so I know it sounds like you have listeners all over,
Yep.
but I do have people that fly in to see me actually, from even other countries. So you can find us. The name of our clinic is Golden Afternoon. So www.goldenafternoon.clinic if you want to take a look at our website, or you can, if you're in Los Angeles, you can go to our website and give us a call, and we can chat more.
Fantastic. Also, so all that information will be in the show notes. Also, make sure to visit wearenikki.com/podcast, enter in BioBeats to get 10% off. And because we really love our customers so much, the way we show appreciation is we give away a free Nikki device and a wellness suite of frequencies on every show. It's a $598 value. So make sure you go to the show notes to enter. Good luck to you. Thanks for joining us again, and have a healthy day.
Thank you so much.
Nikki Wellness Technology. Delivering frequency enhanced health.
It looks like a little watch, but it's actually a frequency device. It's bioenergetic, so it has this little frequency light situation that goes into your arm.
This is my Nikki. It is a bioenergetic wearable that works by emitting a specific frequency carried by a red light, as you can see on the back. It's aimed at enhancing the body's natural healing process to improve wellness and reducing stress, pain, and inflammation. And to select a frequency, you tap it to wake it up, and then you slide to the screens that list the different frequencies. I have wellness or Lyme on mine. So if we want to pick one, we just tap on it, and you'll see the circles around, and there's a play button, play areas, tap there, and you can see the colors radiating that show that it's playing, and you would also see the red light on the back. And to stop, you just tap it again, and then you can slide and select a different frequency. I'm going to play afternoon. And you just tap, and away you go for your afternoon.
So they're two different things. You have the Nikki device, and then you have the frequency sets. And so right now they have the wellness set of frequencies and they have the Lyme set of frequencies, and both of them are absolutely incredible. I use both sets on a regular basis, so I absolutely love them.
Nikki Wellness Technology. Delivering frequency enhanced health. wearenikki.com. The views, information, and opinions expressed in this content are solely those of the individuals involved and do not necessarily represent those of Freemedica. Freemedica Technologies, Inc. and its employees are not responsible, nor verifies accuracy any of the information contained in the following content. The primary purpose of this content is to educate and inform. This content does not constitute medical or other professional advice or services.